Hi, I'm Tom Lathan. Welcome to another edition of Community Highlights Online, a look at the programs, services, and people of Sunnyside Community Hospital. This is part 3 of our series with Diabetes Educator Cathy Fierro. This time, Cathy talks about the incidence of diabetes in Yakima County, and the news is alarming.
We have the highest per capita in the state of Washington.
Why do you suppose that is?
We have a lot of people who are underserved. We have a lot of people that just don't have access to health care. A lot of people who have the wrong information about diabetes. The diabetes rates are highest in African Americans, Native Americans, and Hispanic populations. For some reason, and we don't totally understand this, they seem to not metabolize those carbohydrates like everybody else. So I'm seeing a lot of people from Mexico who are the first in their families to be diagnosed. And so that's a little difficult for them to believe that they have diabetes because there's no diabetes in their family. But in talking to them, it's very interesting to know that where they came from was a very small rural place with very few cars, no TVs, and the food that they were eating were traditional foods, not bread, flour tortillas. Even rice is not a traditional food from Mexico.
Like most healthcare professionals, Cathy believes the high carbohydrate content of the average American diet contributes to the onset of diabetes in many who might otherwise be quite healthy. As mentioned in part 1, Cathy also says complications from diabetes don't have to happen. In other words, you can be a healthy diabetic, but those complications are real.
Some of the complications of diabetes that's not treated and controlled, we think of complications as being blindness, kidney failure, amputations, but there are multiple complications. Dementia is higher in people with uncontrolled diabetes. Their cause of death, more often than not, is a heart attack or a stroke. There's something called gastroparesis, which I've seen a lot in the valley, where your GI tract is just destroyed from those high blood sugars. There's many different things that can go wrong. Again, it's essential that you get the education that you need.
If you have diabetes, one thing you will become accustomed to is checking your blood sugar. That's something that Cathy will teach you how to do, and she will also help you understand the information you collect. Common times to check your blood sugar: in the morning when you get up, and often 2 hours after eating a meal.
That piece of information is going to tell you what happened with that meal. Was I on target? If I'm not, what happened? Do I need to go back to the diabetic educator and get more meal planning?
Our hospital offers a series of 3 classes for persons needing more information about diabetes. The first thing to do is call the number on your screen or send an email to Cathy here at the hospital.
Well, if somebody calls me, they do not need a doctor's referral to call me. I invite them, whether they've called me or the doctor's referred me, I invite them in one-on-one to speak with me. One-on-one meaning I'm the only person there, but they can bring their spouse or support person with them. I ask them a lot of questions, and we just take a look at that individual person, see what we need to do for them. Everybody has a different amount of carbohydrates, calories that they need, and I see, do they need help knowing about their medications? Do they need help checking their blood sugars? There's many different areas that we take a look at. Then I invite them to the classes. I have classes in the morning and in the evening. We don't take tests in the class. We talk and just learn the basics.
The 3 classes cover the basics about diabetes. We've touched on some of that information in our series of 3 videos here online. The second class is with the hospital registered dietitian. She'll talk about cooking and eating when you've been diagnosed with diabetes. And the third class talks in detail about some of the complications of diabetes and how to prevent them. For more information, call the hospital and ask for the diabetes educator. She'd love to hear from you.